seeing, from a clinician standpoint, like Eva was so proactive with this pregnancy that, she was always off on the side doing her exercise or stretching. I don't like to bombard my patients with like 10 different exercises. So at most I would give you like 2, 3, maybe 3 at most, exercises. So maybe if you can kind of talk a little bit more on a little bit of the specific exercise, like what it was geared towards, and maybe like how you felt throughout that, because there's individuals out there like yourself who are currently pregnant and they're like, I don't know what to do. So maybe you can kind of explain just a couple of the exercises that you did, Eva, and like where you felt the work and how that perhaps maybe carried over to, your abolishment of pain that was in the leg and even in the low back.
Yeah. So one of the first exercises that you gave me to do was to do a banded side step. So I would take a band, a resistance band, and put it around my feet at the arch, and then hold that up to probably where my belly button is, and then do side steps from one side to the other side, trying to do about 10 reps. I think that was an important exercise for me because I do think it strengthened my everywhere from my quads to my glute to my lower back. So that way, if that was stronger, then when I was then carrying more and more weight in my abdomen, I was able to keep a better posture and hold myself up a little better. I do think that the stronger the muscles are around your joints, it's going to help you keep from having those joints pinch on the nerves. So that was something that I felt like was really beneficial. Another thing is that my first pregnancy, I had a C-section, which was one of the things that I wanted to avoid during this pregnancy, which I didn't. I had another C-section. However, after my first pregnancy, one of the hardest things to come back was being able to lie on the floor with my knees bent and lift my lower body so that my shoulders are on the floor and do a glute bridge. That I honestly remember took about a year before I could do it unassisted. And so that was one of the things we talked about when I came in. So one of the things you had me do was do a glute bridge weighted, and then or unweighted, sorry, body weight, and then start to do glute bridges where I had it's basically a furniture slider underneath one foot, so that I was moving one foot out and back, trying to exercise the back of my legs and my glute and then my lower back. I think that is something that was really hard. And as long as I could be on my back, it was a really good exercise. It was one of the things we did have to adjust later in pregnancy, because after a while you can't lie on your back. So that became harder and harder. When I couldn't do it, I just had to stop doing it. One of the things that helped my lower back, and if I thought I might have this like phantom sciatic pain where it wasn't real pain, but I could just tell, it tingled down my leg, was to lie on the floor and push up into a cobra position. That would go from having lower back pain or this kind of phantom sciatic pain to, after doing that about 10 times through, it would go away. That again was something that over time, you can't lie on your stomach. But one of the things we did to adjust that for as long as we could was to put, whether it was pillows at home or other things at the gym, to put something underneath my upper body so that I wasn't lying straight on my stomach. And so that was a really good exercise also. I'm trying to remember what other exercise.
Yeah, I think stemming off of the exercise, recall even to get your husband involved, right? Okay. So as you were in your third trimester, and because you had the baby this past October, so I remember one of our last visits was like the 1st of October or something,
Mm-hmm.
something around that range. And we still wanted to promote this extension in the lower back. So remember, we were sitting in the office and we were facing each other, and I had a towel around Eva's waist. And as she kind of sat up tall, I would pull that towel to get her into more of a tallness um, posture. So I term that exercise a seated slouch correct exercise. So I was like, you need to bring your husband into this, let him get involved with the physical therapy process. And, just getting that pressure in the low back, I'm assuming helped you as well.
Yes. And that was one of the things I will say, that it was helpful to be able to come in for routine visits, and also just to touch base with you other times, because I will say initially I went home and I had forgotten exactly how to do it. So the first time we did it, it was very challenging. And I went back and was able to easily correct, you corrected some of the things we were doing. So one of the things that I had from my first pregnancy that helped with the sciatic pain and that we incorporated into my exercise was they call it like a pregnancy belly binder, or you called it an SI joint binder, which makes a lot of sense. I was able to find it on Motherhood Maternity. It's also sold on Amazon, but it's basically a 2-piece binder with a large piece around my lower back and a smaller piece that goes under your stomach when you're pregnant. I would wear that binder during the first pregnancy. I wore it throughout 12-hour shifts while working when I was on my feet. I also used it a little bit during exercise. This time I incorporated it much more into my exercise. And that put pressure on my hips, holding kind of everything in place because your joints get really loose. And so I found that extra pressure was very helpful. Because I had a C-section, I then have an abdominal binder that I asked for while I was in the hospital during the first pregnancy, and I still have it, that I am able to wear during exercise. Amy caught me recently not wearing it because I was tired of it because it got hot. But I will say that the couple workouts I did without it versus whenever I wear it, I have a lot more strength in my core. And I feel like I can do more in my exercises. What it does is it covers up your entire abdomen and your back, so your entire torso. And that abdominal binder, it does help kind of hold in your abdomen, especially after a C-section. But what it does more so for me is it helps remind me to tighten my abdomen and hold myself in place, as opposed to sort of letting it all hang out and then you start to have more pain. So I will say I'm five almost 6 weeks out from this C-section, and I've been able to incorporate more things like very short planks and some other exercises, and that abdominal binder helps a lot. Without that, I don't think I can do some of those exercises.